15 ways to tell if someone is suicidal. As horrific as it may be, suicide is sadly a rather common occurrence. 1 million die each year as a result of suicide. This means that someone dies every 40 seconds. You may know someone who has attempted suicide, or perhaps you've personally attempted suicide. No matter what your experience is relating to suicide, there are common signs that one can look out for. However, as a disclaimer, it's important to note that these signs aren't always easy to spot in everyone that feels this way. Nor does seeing a sign or two mean that someone is actually suicidal. This video is meant to help you understand the signs and determine whether the person needs a friend or professional help. Number 1. No motivation for social life. Suicidal and depressed people often feel disconnected from the people around them, despite the number of times friends or loved ones try to include them in plans. They prefer being isolated. They completely pull away from those who care about them because they don't feel good enough for the people in their lives. Number 2. Happiness and calmness. When someone with suicidal tendencies all of a sudden starts showing signs of happiness and calmness, you may think that they're finally getting the help they need to feel better about themselves. However, this is a common misconception. We know when suicidal people are at their lowest point of depression, they refuse to eat or take part in activities. So at this point, they're actually simply doing absolutely nothing with their time. So most people would think that this is a stage of suicide. But it's not. Committing suicide requires energy, planning. It's a thought process, followed by implementation. So most people attempt suicide just before they've reached their lowest point, because that is when they have the strength to do it. Number 3, changes to their will. In most cases, people will only really write a will or amend it during big changes such as starting a business, having kids, getting married, or after they've lost a loved one. If you find that someone you know wants to make some changes to their will, ask them why this is the case. If there's no hidden agenda, they shouldn't have an issue letting you in. Number 4, low energy. Commonly associated with people diagnosed with depression, this is sometimes coupled with suicidal thoughts, as they often experience extreme low energy levels. These low energy levels are the result of the lack of sleep. It also prevents people from wanting to do the things that they enjoy doing. Overall, since their energy levels have dropped and there is no drive to participate in fun activities, someone that is suicidal will spend most of their time laying down or zoning out, thinking about taking their life. Number 5, suicidal talk. Have you thought about suicide? What do you think about it? What do you think is the best way for one to kill oneself? Have you ever thought about doing it? When someone you know asks you questions similar to this or keeps mentioning suicide, they might be considering it. They seem curious in knowing what your opinion about suicide is, and chances are they're compiling a list and probably weighing their pros and cons. Although this might seem innocent, there is a chance that this person is subtly letting you know their intentions or screaming for help. Number 6, risky behavior. According to research, people who are suicidal are more inclined to take big risks, such as free-falling from an airplane, driving recklessly, or even ignoring the safety protocols when partaking in extreme life-threatening events. Number 7, strange sleeping patterns. When someone has a lot of stress or personal problems, this could affect their sleeping patterns. We might think that the lack of sleep is the cause of suicide, but this isn't actually the case. Battling to sleep could mean that this person is fighting depression or bothered by their suicidal thoughts. Number 8, giving away possessions that hold sentimental value. Someone who is considering suicide will give away the things that they need or their most expensive possessions. This is because, in their mind, they won't need materialistic things in the place they're off to. Additionally, this person might feel that by giving away these invaluable items, they're making amends for their upcoming absence. Number 9, alcohol and/or drug abuse. When humans don't feel connected to anyone or anything, they tend to latch onto alcohol or drugs to make them feel stronger. Suicidal people will use drugs or alcohol because they think that it will give them the willpower they need to take their life. Number 10. Obtaining a weapon. Simply owning a weapon, for example, buying a gun out of the blue, is not particularly tied to being suicidal. However, considering the previously mentioned signs, as well as the rest of the signs in this video, this could be a red flag. If you know that this person has no interest in joining a shooting club or going hunting, this weapon could serve as a deeper purpose. Number 11. Not participating in activities that they love. As mentioned a few times before, suicidal people possess depression-like symptoms, and part of this means that they no longer want to participate in the activities that bring them joy. Absolutely nothing seems to matter anymore, and all interests that they once have diminished. Number 12. Self-harm. This is the most prominent factor that someone could be suicidal. This is because suicidal people want to feel something else besides the numbness or emptiness. They hurt themselves to reduce the negative emotions that they're experiencing. Examples of self-harm include slitting one's wrists or anywhere else on the body, consuming poison, or burning oneself. On the other hand, some people turn to self-harm in preparation for suicide because they want to test the waters and see just how far they can actually go with hurting themselves. Number 13. Body language. Although body language is a very general sign and can be difficult to say whether someone is suicidal or depressed, together with the other signs mentioned, when you notice that someone doesn't make lots of eye contact and has shrugged shoulders often, it could mean that they're suicidal. Number 14. Emotional outbursts. Sometimes suicidal people will negatively react to random comments that you make. Your comment could be reminding them of their parents, childhood, or a traumatic experience. Even though their outbursts might not make sense to you at that moment, it could be a sign that they have unresolved trauma resulting from suicidal thoughts. Number 15. Past suicide attempts. If you know that someone has previously attempted suicide, then this is the most important sign of all, because this person might have suicidal tendencies. Someone with these tendencies does not simply stop. Suicidal people do not feel like killing themselves one day and then wake up the next morning and simply feel as if they want to live for the rest of their life. This is especially true if they've not sought any professional help to manage their thoughts in the past or present. Well, there you have it. These are 15 signs that someone could be suicidal. In the comments section, let us know what your thoughts are on these signs, and tell us if there was something we've missed. We love hearing from you. As always, thanks for watching, and remember, if you liked this video, then be sure to subscribe for more.